Welcome to the Caladrius Health Channel. In this explainer, we're going to take a bit of a wider view. We'll look at how different health systems around the world have tackled claims exchange infrastructure. The goal here is to see how these global patterns can give us some context for India's own evolving architecture.
So here's our game plan. We'll start with that global perspective. Then we'll dive into three really distinct design philosophies. We'll look at the market-driven model in the United States, then the real-time integration you see in Australia, and finally the policy-led systems of Singapore and Germany. After that, we'll zoom back out, pull it all together, and see what patterns emerge and how they relate to India's journey.
All right, let's get into it. Building a national health claims exchange, it's a huge undertaking. And as we're about to see, there's really no single way to do it. Each country's approach is kind of a unique reflection of its own history, its policies, and what it prioritizes. So the big question we're digging into is this. How do these different systems actually structure the flow of insurance claims? And just to be super clear, our focus here is purely on the architectural design, the choices they made, not on trying to judge which system works better or worse.
Our first stop is the United States. Its system is probably best described as a market-driven, multi-vendor model.
So instead of one single government exchange, the U.S. system relies on a whole network of private companies called clearinghouses. You can think of them as intermediaries. Now, they don't just do whatever they want, they all have to follow federally mandated standards, which were set up by that landmark HIPAA legislation.
And this really shows you the results of that structure. You've got a system dominated by private players, which naturally creates a lot of complexity when you're dealing with hundreds of different insurance payers. And even with those mandated data standards, this kind of decentralized design leads to high administrative costs. We're talking 15 to 30% of total health spending. Now, this isn't a flaw, really. It's just a direct consequence of this particular market-driven architecture.
Okay, now let's shift gears and head over to Australia to see a totally different model, one that's all about deep integration right at the point of care. Australia's HICAP system has actually been around since 1998, and it's designed for real-time processing. The whole idea is beautifully simple. A patient visits a provider, and at the end of the visit, they just swipe their insurance card at the payment terminal. The claim gets processed right there, instantly. And this number gives you a sense of the sheer scale of that integration. HICAPS processes over 41 million claims every single year. That covers something like 87% of all allied health insurance claims across the country. It just goes to show how deeply this point-of-care model is embedded in the Australian system. Next up, we're going to group Singapore and Germany together. Why? Because they both show us what happens when strong policy and government mandates are the primary drivers of the system's architecture. Let's start with Singapore. Their model is really more than just a claims exchange. It's a very tightly integrated ecosystem where all the pieces, data, workflows, and financing are coordinated from the center. This timeline really highlights Singapore's deliberate, long-term strategy. I mean, look at this. The journey started way back in 2011, with public hospitals contributing data. It then evolved over 15 years, leading up to legislation that's going to make participation mandatory for all providers by 2027. It's a perfect example of a careful, phased, policy-driven rollout. Germany's model is also driven by strong government direction. It's built on a foundation of legally enforceable standards and mandatory participation for everybody involved. And you can see that structured, enforced rollout in action right here. The 2019 Digital Healthcare Act laid the legal groundwork. Then it set these firm, non-negotiable deadlines for pharmacies and hospitals to get connected to the national network. And to make sure it happened, they backed it up with financial penalties for anyone who didn't comply. It's a textbook case of a mandate-driven implementation. Okay, so we've looked at these different systems individually. Now let's take a step back and see what common patterns start to emerge when we look at all of them together. The first, and maybe the most important pattern, is time. Building these ecosystems is a long-term game. In the US, it took about 15 years for HIPAA standards to get fully adopted. Germany's network was over a decade in the making, and Australia's system has been evolving for more than 25 years. This is definitely a marathon, not a sprint. So, 4 clear patterns seem to pop up across these examples. First, like we just saw, adoption takes years. Second, technical standards are crucial, but they aren't enough on their own. You need strong governance to build trust and consistency. Third, it turns out that mid-sized providers are consistently the toughest group to get on board. mostly because they often don't have big IT teams. And finally, the ultimate value of the entire system, it all comes down to the quality of the data flowing through it. Good data in, value out. Simple as that. So, the main point here isn't to find a blueprint to copy. It's that looking at these international examples gives us some solid principles. These patterns really help us understand the fundamental forces that shape how any large-scale system like this is going to evolve over time.
And that brings us to India's context. As of April 2026, the NHCX ecosystem has grown to a pretty significant scale. You've got 83 payers and over 42,000 providers on board, and they've processed over 23 million claims. You can see its path is taking shape within a similarly complex, multi-stakeholder environment to what we've seen in other parts of the world.
And this is really important. The formal governance layer is maturing right alongside the technology. A key sign of this is the formation of an IRDA subcommittee in April 2026, which is specifically tasked with reviewing adoption. That's a big step in institutional development. In an environment that's changing this fast, technology platforms play a really crucial role. They help providers align with these new ecosystem requirements and just navigate the transition smoothly. When it comes right down to it, the main takeaway is this. No matter where you look, these complex systems aren't built in a day. They take shape over many years, and they are profoundly shaped by local context, the governance structures in place, and the sheer scale of the challenge. And India's ecosystem is no different. It's evolving as we speak, within a similarly complex and highly dynamic environment, and it's following a path that has echoes and parallels all across the world.